Good afternoon. Good afternoon, Rhode Island. It is a beautiful, warm, sunny spring day. So everybody try to get outside even for a little bit if you can. It helps with physical health, mental health, and a little vitamin D will boost the immune system. Thank you for tuning in today. I continue to hear from people that they look forward to the 1 o'clock briefings as an opportunity to get the latest and most accurate information. So I'm very happy to be able to do that. We'll be back again tomorrow at 1 o'clock, taking the weekend off, and then back at it again on Monday at 1 o'clock. At this point, I feel, we are holding our own, more than holding our own as a state. And I feel confident about where we are, where we're going. That in no way minimizes the challenges that Rhode Island is facing. And I know they're extreme health challenges, financial challenges, mental health issues. But I want you to have a sense of confidence that we're on our road to recovery. We will get there. This pain is temporary. And in the meantime, you have a lot of people working overtime every day, all day, to continue to bring you some of the support that you need in order to get through this. And for your part, I would just really ask, beg, implore, order that you just keep following the rules. I cannot wait for the day that I can get up here and say, there's no more limit on social gatherings. We don't have to wear our masks. But today isn't that day. Today is not that day. Our cases are plateauing, but we still have communities where we have, 20 to 25% of the people we test are positive. We still are learning about the virus. We still have a lot of issues in our communal care settings. So today and next week and the week after that are days to really commit yourselves to following the rules, wearing your mask, or at least don't leave the house without it in case you run into somebody. washing your hands, staying home if you are sick or have any symptoms, getting tested if you feel sick, calling your doctor, keeping your social gatherings limited to 5 people, working from home. If we hang in there just a bit more and really try to follow these rules, we will be in much better shape, a month from now, and more able to continue to open the economy. And if we don't, our situation is kind of fragile right now. And the last thing we want to do is slip backward. As I said yesterday, I want to reopen this economy once. I don't want to do it and have to come back. So hang in there, please. It's really hard. Please be patient and flexible and creative and have confidence that this is temporary, absolutely temporary, and we are going to get through it. Today, I had hoped to be able to give some specific guidance on when we're going to move to phase 2 and how we'll be graduating, going to your senior prom, graduating, going to your senior prom, being the captain of the sports team, going to all kinds of banquets at the end of the year, spring activities, and this virus came along and threw a wrench into all of those plans. And it's tough, it stinks, and I'm sorry that the virus pulled the rug out from under you right when you were so close to the finish line. So we're working overtime to try to come up with creative ways to help you celebrate your accomplishments, to have some fun, and help get you together with your classmates. So I want to let you know that on June 15th, we're going to be airing a special televised graduation ceremony. PBS will be airing it on June 15th. We're going to be calling it Your Year 2020. And it's going to be a statewide televised high school graduation ceremony. We are lining up some really fun guests. We're aiming high to give you some surprises. We're trying as hard as we can to make this as memorable as it can be. To the class of 2020, the deadline to submit videos that we're going to be featuring on this graduation is next Friday, May 22nd. So you can go to the PBS website, pbs.org/youryear2020. But I'd encourage you all to submit a video. This isn't what you wanted, but let's make the best of it. And if everybody leans in and makes it fun, it will be fun. And thank you to PBS for airing that. We want to make it a night you'll never forget, even though it's not exactly the graduation you would hope for. Okay, moving on to summer camps. As I reflect on the questions I receive in a day or in a week, this is at the top of a lot of people's list. That makes sense. Our kids are struggling. Some are doing beautifully with distance learning. Many others are having a hard time. They're getting through it. They're learning. Teachers are doing great. But a lot of folks want to know, what about summer? And I promised you, when I made the decision to keep schools closed for the rest of the year, I promised you then this wouldn't be a see you in September, good luck for the summer. And I intend to honor that promise and do everything we can for our kids to have some interesting, fun things to do this summer. So as a result, I'm announcing now that we'll begin to allow summer camps and youth summer camps to operate in person in the state of Rhode Island starting on June 29th. So that's, a week or so after the end of the school year for most kids. Now, that's the good news. But let me set expectations right now. It's not going to be just like last year. There are going to be new cleaning regimens, new restrictions, new guidelines. It's going to be fun, but different. And let me also say, the June 29th goal is just that, it's a goal. We're going to be working like crazy between now and June 29th to make that goal a reality. But just like everything else, it's subject to change. If by June 29th, we see a lot more cases, things aren't going well, our systems aren't working, our hospitals are starting to get over full. By the way, I don't expect that to happen, but if it does, I may have to adjust that June 29th date. So, but as long as we are where we are now, ahead of the virus, everybody's following the rules, everybody's wearing their masks and doing social distancing and working from home, we should stay on an excellent trajectory. Cases going down, hospitalizations going down, and I want to start summer camp June 29th. I'm saying this now because there's a lot of planning to be done. A month or so ago, 2 weeks ago, I announced childcare would be coming back online June 1st. I did that because it takes time to get ready for June 1st. It's going to take time to get ready for June 29th. It's going to look different. It is going to look different. What will it look like? We're going to ask the camp providers to keep kids in small, stable groups. We think of it as a pod. Maybe that'll be, 10 kids, maybe slightly more than 10 kids, depending on where we are in June and July. But we don't want it to be a different 10 kids every day. So if you're going to be, playing lacrosse with these 10 kids on Monday, you're going to be with those 10 kids on a Tuesday. If you're going to, you get the gist. We want small groups of children in stable groupings, limited in their interaction with a stable, small number of adults. We've believed that is the safest way to do it. We're going to do our best to have these kids and the adults keep an appropriate social distance from each other, maintain regular deep cleaning, regular cleaning of shared surfaces, regular cleaning of shared sports equipment to the extent that there is any shared sports equipment, frequent hand washing, checklist to make sure no children or adults who feel sick are allowed to go to camp that day. So it's definitely going to be different, and that's why I want you to start thinking about it. But the truth of it is, our kids are missing out, right? I have 2 children of my own. Every kid, they miss their friends, they miss regular life. They miss doing what they love to do. For some people, it's dance. For some people, it's art. For some people, it's music. For their mental and emotional and intellectual development and health, I think we need to try our best to operate summer camps this summer. This will be an extra burden on municipalities. Municipalities operate many of these summer camps. We are in daily contact with our municipal leaders on this. I've heard from them that this is going to require additional resources. I hear you. That's exactly the kind of thing that our COVID emergency fund is positioning us to do. So let's work together to figure that out. All of the private providers, I know are going to be looking for guidance. So we're going to start now. We have well over a month, and we're going to get there. Let's do our best for these kids because they deserve it. Summer's important, and we're going to nail it for them. We're also going to continue teaching through the summer. You know, we don't want any kid to get behind, so we're going to do our very best to have a full array of summer options, not just sports and extracurriculars, but also learning opportunities. Make sure there's a very limited summer learning loss. And then any kids that have to make up school or class, we're going to be providing that as well. So we have a full-on effort right now to figure out how to do this. Starting next week, the details of these new guidelines will be at reopeningri.com. So I've given you the basics of it now, so you can start to plan. But starting in a week, hopefully before a week, hopefully next Wednesday or so, go to reopeningri.com and you can get very detailed guidelines around how you can safely reopen summer camp this summer. And we're going to do our best. And to the kids out there, know that we're going to do our best and know that there will be some summer programming for you this summer. And I just encourage you to have as much fun and as much learning as you can and just kind of roll with it with us. I've also been getting a lot of questions about organized sports. It's hard to be this time of year and not think about Little League or be playing Little League or softball or all these other things. This is a tough one, okay? This is a tough one. The CDC has recommended canceling or postponing all organized youth sports. I can't really go against that guidance, and I don't plan on going against that guidance. So until the CDC guidance changes, organized youth sports games in Rhode Island can't happen. That's a rough message. It doesn't mean we should throw in the towel, though. Sports are so important, not just for the sport of it, but they teach children how to stay active, how to work on a team, so many other skills. I know I wouldn't be where I am without having played sports my whole life. So I want to enable as much as we can. So right now we are looking at ways to enable some sports, summer sport camps. I know a lot of folks do lacrosse or golf or soccer or basketball, whatever you like to do. I'm hoping to be able to have those summer sports camps. Way to have limited sports gatherings, way to allow sports practices. So just for today, we have to follow the rules that the CDC is putting out, which means no Little League, no organized youth sports, no traveling soccer leagues, no competition. The real health issues come into play when you've got one team playing against another team and playing against different teams, you know, every week. That we can't do. But we're gonna work hard to figure out what we can enable in a new way so you can keep playing sports, practicing sports, and learning sports throughout the summer. And I'll be back with more guidance on that specifically as the days and weeks go forward. I also get a lot of questions about libraries. It's come up in these press conferences a few times. As a reminder to everybody, library buildings currently in phase 1 in the state of Rhode Island remain closed. Library building, public libraries are currently closed in the state of Rhode Island. Having said that, libraries have been incredibly creative. Currently, about half of all of our public libraries are currently offering curbside pickup of pre-ordered library books. I know so many people rely upon the library to get the books that they need for school and life or their job. You could continue to do that. Just over half of libraries call ahead, order ahead, go online, order ahead, curbside pickup. I'd encourage you to get in contact with your local library because they're all doing it in different ways, but most of them are doing it. As we move into phase 2, Many libraries will start offering limited browsing at the library in a limited way with new guidelines in particular areas. Curbside pickup will still continue. We're going to look to be able to enable going to the library to take out a book. In-library services will be provided in accordance with the regulations of phase 2, which is to say, you'll have to wear a mask, you shouldn't go if you're sick, social distancing applies, you can't go and get together in a big group, you can go and read a book with your family or alone, you have to stay away from other patrons of the library. Extra cleaning will be required for the libraries. We're still working on, we want to be able to enable use of the computers. Obviously, that's a key service that they provide. And I don't have anything to say about that yet today. That's a tricky one. You know, it's hard to fully sanitize a keyboard enough times during the day. So that may or may not be possible, but we're working on it. And I just wanted folks to know in phase 2, it is definitely our hope to expand libraries and go ahead and open the doors again. The doors of the libraries will be open. So more on that later. Finally, I wanted to say a word about a survey that we're going to be launching. So due to the hard work of our awesome federal delegation, Senators Reid and Whitehouse and Congressman Langevin and Cicilline, the state of Rhode Island has thankfully received $1.25 billion in a COVID emergency relief fund from the federal government. That money is intended to enable the state to deal with the immediate crisis before us. Hospitals, nursing homes, you know, everything, municipalities, public safety, all the PPE we've been purchasing, ventilators, the extra hospital surge. We needed this money. We're using this money carefully in order to meet the needs of Rhode Islanders. Soon, in early June, we're going to have a portal online so every Rhode Islander can see how every penny is being spent. I'm committed to transparency. But we also need to use this money to help our economy get going again. And the money is expressly intended for that. What the federal government has called the secondary effects of this. Frankly, the secondary effects are the fact that we have 200,000 Rhode Islanders who have applied for unemployment insurance. We have retailers and restaurants and small businesses flat on their back because of this crisis. We have lots of low-wage Rhode Islanders who are out of work in industries like retail that are going to take a long time to get back on their feet. So, and I'm hearing it every day. Other governors have started to use the relief fund to help small businesses. When are you going to get to the business to helping us? So I want you to know we are going to do that. It is absolutely my intention to use this money as intended to help you get back on your feet. But I also want to hear from you. So we have had a place on the Reopening RI website that you can send us your ideas. We've gotten a lot of ideas. Keep them coming. Let us know what you need. Let us know how we can help. It's been incredibly helpful. But starting early next week, we're going to do a survey. We're going to do it on Monday to have kind of an official survey, mainly of small businesses who've been affected, just to hear from you on what would be most helpful to you to meet the immediate economic pain that you're facing. So I hope to have more details on exactly how you can do it. But again, it's reopeningri.com. And I just want you to know I'm committed to it, and we are going to work fast to start using some of these stimulus funds to get Rhode Island back on its feet. So with that, I'll turn it over to Dr. Nicole Alexander Scott and then come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. I'll start with an overview of the data. We have 181 new COVID-19 cases to report today. There are 271 patients who are currently hospitalized, And of those people, 65 are currently in the intensive care unit, and 42 of those 65 are on a ventilator. We unfortunately have 6 additional COVID-19 associated fatalities to report this afternoon. 1 person was in their 70s, 2 people were in their 80s, and 3 people were in their 90s. As I said yesterday, we are encouraging everyone to try to take a moment of prayer or reflection at some point in the day to support those who are dealing with the loss of a loved one right now. Because the governor spoke a little about summer camps and sports, I want to spend a moment briefly talking about children and COVID-19. While there's a lot we're still learning about COVID-19, we do know that children don't appear to be at as high a risk. Fortunately, we've had a smaller number of COVID-19 cases among children here in Rhode Island, and this has been the experience of most other states as well. The children who have had COVID-19 across the country have generally shown milder symptoms. Those symptoms have often been a fever, runny nose, or a cough. However, it's still incredibly important that we teach our kids what steps they can take to help stop the spread of viruses. It's even more important, particularly on a beautiful day like today, to make sure that we are modeling for our kids the measures that need to be taken to stop the spread of viruses. Children should wash their hands often using soap and water for at least 20 seconds. This is especially true if a child has been in a public place. For a lot of children and adults, singing or humming happy birthday twice is the easiest way to know how long 20+ seconds lasts. Another note that I want to make that is so important is that we create opportunities for communication with the kids in our lives about what is happening in the world. You may have heard news reports about a possible connection between COVID-19 and a health condition in children currently called pediatric multi-system inflammatory syndrome. Doctors around the world and here in Rhode Island are watching this very carefully and trying to learn all that we can about it. It may be thought to be similar to other childhood conditions such as Kawasaki disease, but this is thought to be somewhat differently, particularly because I am an infectious disease doctor for both adults and children. We benefit as a state from having a very close relationship with our providers in infectious disease, critical care, immunology, watching closely what's going on with this illness. We're meeting just today even to make sure that we are all on board, and there's already an active plan led by our colleagues at Hasbro Children's Hospital about how we will prepare for and be ready to respond extensively and appropriately to this if we were to need to here in Rhode Island, while we have not had any confirmed cases as of yet. As we work towards communicating with children the news that you're hearing here every day and what's accurate, it's important to know that not every child is going to want to talk about COVID-19, and that's fine. But it's still important to give children space to ask questions and to express their fears. It's also really important to be aware of how your children get news and information, especially older kids who can go online. You really want to make sure you're steering them towards age-appropriate content. Talk about COVID-19 is everywhere today. So helping children process what they are seeing and hearing all around them is incredibly important. This can help alleviate some fears and anxieties that adults sometimes don't even know is present in the kids in our lives. Open communication is extremely important with our children generally, but this is especially true at a time like this. With that, I'll turn things back over to the governor to get us started with questions.
If I might direct a question to you, what has been the experience? You talk about there have been cases among children in Rhode Island of coronavirus. What has been the experience here in Rhode Island among pediatric cases?
We have had relatively few cases among children. For those less than 10 years of age, we have had 2% of the cases, and those less than 20 years of age, total of 4% of cases. So thankfully, we have done well here, as is the case in other states, and we have an excellent pediatric provider community that's ready to respond further.
In line with the experience in other states?
Yes.
Dr. Alexander Scott, today's testing numbers were quite high, close to 3,700, but the positive rate was quite low, 181. I think that's about 5%. I know in the past you've said those numbers are sometimes correlated to the specific groups you're testing. Is that the case today?
It continues to be that. What you shared is the goal we want to work towards. Make sure we have expanded testing and are testing enough people to capture the fact that fewer and fewer people are infected. The only way we can do that effectively is to make sure that we continue to target the communities that we know are most impacted. And we make sure that we pull apart that data and really analyze it to understand by zip code, by community, and still working on, as you had suggested previously, by testing site to make sure that we have the resources for every community from every zip code to respond.
Doctor, you accomplished quite a feat when you announced on Monday that every resident and every staff member of every congregate care facility nursing home had been tested and would be on a cyclical testing cycle, cyclical testing run. And I'm curious about the congregate care facilities that are essentially the two prisons in Rhode, the ACI and the Wide. Now, my understanding, I believe, is that there's been no cases of prisoners who tested positive for COVID at the ACI, correct me if I'm wrong, but the reports that the Wide is filing with the federal court under order indicate what looks to be, or what appears to be, the beginning of an exponential curve with positive tests in double digits. And the Wide, from the report, appears to be testing, about 20 people a week, 20 detainees a week. And what is the Department of Health doing in support of that testing effort? Are you doing anything comparable to what you've done with nursing homes, send in mobile teams, testing facilities, and so on? Or are you in a more supporting role to the medical staff there?
While the federal government is the primary responsibility or responsible organization for the response at Wyatt, as I've shared before, our state epidemiologist and our team has been in very close contact with the medical director there, because we want to make sure that any outbreak setting in our state has the response to keep it under control that's needed. Based on that, we have engaged with them, pulled in the resources of our congregate setting support team to make sure that they have the education they need to enforce the infection control policies that are going to be necessary to keep their outbreak response under control.
Is the Department of Health supplying tests to Wyatt?
We are working in coordination with them. They are the sole accountable entity to do it, and we want to make sure that we fill in any gaps and help push them in the direction that's needed to go.
Doctor, can you please discuss a little bit more this Kawasaki-like syndrome, what it is exactly, and what the fear is by Hasbro Children's?
Yes. In advance of doing that, I wanted to answer the element of your question that was also included. We have, not only with nursing homes, but with congregate settings, activated our comprehensive proactive surveillance program across the board, as I have shared. As a result of that, within the last 24 hours, we've learned, based on our proactive testing activities for the congregate setting of the ACI, we have identified a small portion of inmates who do not have symptoms, but have a positive test. We're working very closely with the ACI regarding those cases. They are isolated appropriately, and all of this has been part of our proactive response with all of our congregate settings and what we intend to do going forward across the state as a part of our expanded testing strategy.
Small.
Less than about 5 or so. And we're still collecting the data, so we'll be updating that. In terms of the multi-system inflammatory syndrome, we are learning each day as it occurs. Kawasaki disease is an analogous but distinct inflammatory disease that we are all still learning about, even though it's decades old, and really responds to an inflammatory reaction to some form of inciting element, such as a virus or other entities that can occur. Symptoms connected to that include a fever that may not go away, abdominal pain, diarrhea or vomiting, a rash, which many people are seeing in the pictures, trouble breathing, or a child who is sleepy or has other elements. Our very close relationship with the provider community, particularly Hasbro Children's Hospital in this scenario, really demonstrates for us that we are fortunate in Rhode Island. We have engaged, active, brilliant providers who care about the patients, have already reached out with a proactive plan of engagement, and are going to be joining our group discussion today with infectious disease docs and critical care doctors to make sure across the state everyone is on board with our plan for going forward.
Dr. Alexander Scott, if you could just provide an update, is there any indication that case numbers are decreasing at nursing homes, or any indication that the steps that you've taken there, whether it be the National Guard or increased testing, are having a positive result, or is that flat or worsening, or what's the situation?
As we're continuing to assess that, it's going to be a balance in definitively saying, because of how proactively we are working to get testing done and to continue to identify people who may have COVID-19 exposure and a positive test with or without symptoms. The more testing we do, the more we will identify, the more we will also be able to respond. So over time, we will start to see the benefits of this. We are absolutely convinced that this aggressive, comprehensive approach is the way to go, making sure that nursing homes, congregate settings has the PPE they need, the infection control guidance that they need, the testing, ability to cohort in the way that they need to. It is a massive undertaking. It is our top priority, and I'll continue to keep you posted as we go with showing the benefits that we are sure will come over time.
Has there been any sign of improvement so far?
There has been, in that we've been able to provide nursing homes and congregate settings the support that they need, knowing that there's still more to go. When you see that the PPE is in place, when we make sure that the infection control guidance is offered and being followed, when we know that we are, we've completed the first round of testing and we want to circle back and continue more, those process measures are definitely what we need in place to be able to say that over time we will see the outcome improvements we are determined to get.
But not in terms of case numbers, you can't say.
Correct, because it's challenging to see, because we're continuing to identify more and more, which is the goal in our approach.
Doctor, yesterday's report from the Rhode Island Department of Corrections said there were no sentenced inmates with COVID-19, and now you're saying that's closer to 5?
Within the last 24 hours, based on our proactive surveillance. And I'll be updating on the actual numbers. We're still collecting that data. Yes.
Sentenced inmates, not people held as commitments, like people have come in and segregated these people in the population?
Well, yes, and we're still confirming as we'll make that clear going forward.
Thank you.
Governor, I have a question about the summer sports camps. Why not leave it up to the players, the parents, the coaches about the summer sports camps? And I want to be specific.
Yeah.
There's a young man, now I attended Bishop Hendrick. There's a young man, he's a junior. He just got a full scholarship to play football for Notre Dame, which, as you know, is unprecedented in Rhode Island. The reason he got that is last summer at URI football camp, Michigan, other colleges saw him. Now, at these camps, and that is his ticket. If you take that away, that's a chance. They test speed, agility. They want to interview the young man or, boy or girl. But why not leave it up to them to set up a safe atmosphere for these summer camps?
What I'm doing. Like, that's a perfect example of a program that I hope will continue. I mean, that's not up to me. There's going to be a lot of, like you saw this morning, that they decided Camp Yagu is not going to have the overnight camp this year. I respect that decision. What I'm saying is starting June 29th, you can, as long as you follow these health and safety guidelines. And I hope that most will. That's exactly why I'm doing it, because I think sports are really important. A lot of kids get a lot out of these summer camps. So I'm hoping that more often than not, all those providers will say, yes, we're going to provide the camp. We're just going to follow the new rules.
Just to follow up on yesterday, received a lot of email about, and you mentioned possibly with hair salons, that workers might be tested. Any other thought on that, or if they set up an atmosphere where their clients have to be tested or they would be tested?
So what we're trying to do, I'm trying to set up a system where we enable business safely, but also that builds confidence. I'm very aware of the fact that a lot of people are afraid. Even though you can get your hair cut or go out to a restaurant, a lot of people in Rhode Island are saying, I don't want to, I don't feel. And that's not good for the economy. I actually want, when we say it's okay to get your hair cut, I want you to all go out and get your hair cut. So I'm trying to figure out, how do we create an environment where you feel confident to do that? And some of that will be testing. Now, I don't know if we have the capacity to do every hairdresser or barber, or if we even need to, but the thought is having a pinpointed testing program for these close in contact business owners, I think will build confidence to the client that I know my hairdresser's been tested, was tested negative, I'm gonna go get my hair cut. So I don't have the answer today. We're talking to hairdressers and barbers and small businesses and restaurant owners every single day. We're trying to get from them, what do you think you need? What do you think your customers need to hear in order to feel confident? And if they come back and say, we want to be tested on some regular basis, then I want to try to figure out a way to do that.
Have you heard a lot of Rhode Islanders don't want to go dining before they can go to the hairstylist?
I think we all have overgrown hair right now, so we should just go for it. Wear your mask, no one will know who you are.
No judgment dining.
No, exactly, no judgment.
Great, and everyone's lost weight.
Fabulous,
All right.
exactly.
Governor, back up. The summer camp. Is the expectation that kids would have to wear masks at summer camp, even sports camps yet, or?
Yeah, we're still figuring it out. I think not, but we're still figuring it out.
And then just if you could, I know a lot of parents have probably already paid for a lot of either spring or summer sports programs that are now, again, in limbo or canceled. Will the state have any guidance on what should happen in terms of the money?
Those are all private businesses, all governed by their own private arrangements and contracts. So my job is to provide guidelines around how you can safely operate the camps. I hope they do it. And if they don't, then it's up to them to figure that out.
Governor, when it comes to the camps, grouping children in smaller groups often means more staff. Are you going to help them get more funds so they can hire?
Exactly. So that was the point I made about using the COVID emergency relief fund. So already we've been hearing from mayors and town leaders saying, okay, we want to do this. We want to make sure there's an opportunity for our children. It's more expensive. It's more staff. It's more cleaning supplies. So we are aware of that, and I plan to use some of the stimulus funds to help them do that.
Governor, you mentioned learning during the summer. Any specific plans at this point for whether summer school will happen and whether that will be digital or potentially in person?
Summer school will happen because there are kids who need to either make up a class or have special needs. It will most likely be primarily virtual, but not exclusively, and we're working on it right now. But for anyone who knows they have to make up schoolwork, you will be able to. We're going to make it possible.
Thought nobody was going to flunk.
No, I never said that. All right,
All
thank
right,
you.
thank you, everyone. We'll be back tomorrow.